Hi, I'm Elena, and this is Heidi, and I'm going to show you some basic stretches that are common to do after a cruciate surgery. First, it's really important that you never stretch a cold muscle. So when you're stretching your patient, you want to make sure they've either had a walk or some exercises, some heat treatment, massage, or some laser therapy first. And then next, you want to make sure that when you're doing a stretch, that you do it in a really gentle, pain-free way, as your patient needs to tolerate this. If you overstretch, then they're going to contract the muscle and they can even injure themselves. So first, I'm going to show you how to stretch the hamstring muscle. So we take the limb into extension. You want to make sure you're supporting the stifle really well, so we don't put any pressure on your post-op stifle. Extending the stifle, and then advancing the limb forward slowly. Then you hold this stretch for about 20 to 30 seconds if they can tolerate that. So as you saw her pull back, and so then I just decrease the pressure of the stretch. Next, to stretch the gracilis muscle, we have the same hand placement. We do the same with the stifle, extending it into full extension, and then just adding a bit of hip abduction, and then advancing the limb slowly. So that was a bit too much. So just backing off and coming back, and probably just starting here for a while, and doing that until it releases a little bit more, and then advancing forward as she can tolerate. Next, to stretch the quadricep muscle, just want to flex the stifle, but also in this one, we're not going to be involving the rectus femoris muscle, so we'll add some hip flexion to take that muscle out of the picture, and then just flex the stifle. And this will be stretching your quadricep muscles. To add the rectus femoris and sartorius, we're going to just bring the hip into some extension and supporting the stifle, then just gently flex the stifle. And that's stretching the sartorius and the rectus femoris. Stretching the adductor and pectineus muscle, once again supporting the stifle. Just bring the limb into pure abduction. To stretch the gluteal muscle, we bring the hip into flexion. And you really have to bring it into quite a bit of flexion to actually stretch the gluteal muscle. To stretch the digital flexors, we bring the digits up into extension at the metatarsal phalangeal joint for the superficial digital flexor, and then we extend the distal phalanx to get that deep digital flexor. Next is the iliopsoas, which isn't that easy to stretch. So, once again, stabilizing the stifle. You want to apply an internal rotation above the stifle joint, so we're not putting any pressure on your post-op limb. Then taking the limb into some abduction of the hip, and then extending back. Now my pressure is above the stifle, because we don't want to be putting any pressure below or on the stifle, as that could hurt your post-op cruciate. Next, to stretch the iliopsoas, you're going to take the limb into internal rotation of the femur. So you want to be supporting the stifle and applying your pressure above the stifle and applying the internal rotation, so in that direction. Then you want to apply an abduction of the hip, so this direction, and then extending the stifle back. Now you want to make sure that all your pressure is above the stifle, so not to injure the post-op limb while stabilizing the stifle with the distal part of your hand. I like to stretch throughout the rehab journey daily and actually continue this throughout the patient's entire life.